Minister Reddy, you were speaking earlier on about the challenges that you faced in the context of a newly formed state and trying to respond to the pandemic. Just talk to me then about how do we future-proof health systems against those kind of pandemics that you've spoken about from a governance perspective as well.
As I said earlier, governments would have to be focusing on two things. One is preventive care, and the other is curative care. And looking at this from the lens of how to improve this health care, one would have to be talking about availability, accessibility of health care, and also affordability of health care. All these three would have to be moving in line. In order to do that, from my state's perspective as to how we have been wanting to move forward is, we've taken every 2,000 people, every population with every village with 2,000 population as a unit, and we're coming up with village clinics. And then we're taking up every 30,000 population as a unit and classifying it as mandal, and where we're coming up with 2 PHCs, primary health centers. These primary health centers would have 4 doctors, 2 of the doctors present in each of the PHC center, and they would be given an ambulance 104. And each of this doctor would be given their designated villages. So 5 villages or 4 villages, depending on the mandal size, to each of these doctors. And these doctors, every alternate day, would hop onto the ambulance and visit the village. And they would become the family doctor for that village. Very soon the doctors, because they've been designated only those 4 villages, so they would start to identify people by names. And they would use this village clinic as a hub. This village clinic primarily would be having an A&M, nursing graduate, mid-level health practitioner, and ASHA workers that we spoke about also reporting there. So that would take care of the preventive part. Now comes the curative part. The curative part would be dealing with the community, with district hospitals, the teaching hospitals. The area hospitals and the teaching hospitals are going to play a very critical role there. So there we are coming up with every parliament taken as a unit in order to ensure that there is equitable distribution of teaching hospitals. Because only when you establish teaching hospitals, you have postgraduate students actually coming up there. And only when you have postgraduate students doing their course there, and these teaching hospitals are connected to a hospital, a teaching hospital as well. So teaching college and teaching hospital together would become the tertiary care that we are looking for.
Okay. We're going to come back to that issue a little bit later on if we've got time. Catherine, when we're speaking about migration, is it correct to quantify it as a crisis, 1? And 2, what possibilities are there for planning scenarios where even if there is a crisis, there's resilience in healthcare services, and there's also a form of adequate care?
Well, yes, it's absolutely a crisis. I mean, the estimates are that 36 million children right now are in migration, sort of crossing borders, and another 20 million are moving inside countries, so IDPs. And that's a horrible problem for children around the world because it's so unstable for them, right? They're moving from one place to another. We don't have good data on whether there is sufficient health care in these migration situations, but we know there's typically not, right? It's very hard. And
lengthy questions, in fact, put forth a lot of them. But as she rightly said, we have constraint on the funds. But yes, this is something that we need to deal with it. And in spite of our difficulties, we're pushing through with it. And we've allocated a 3-year window where we're wanting to mobilize $2 billion, 16,000 crores into this whole setup. And we are heading in the right direction, and we will do it. And as far as the doctors are concerned, as you've just spoken, we do understand that this is a predicament that we need to deal with it. And that's exactly why we are trying to open up more medical colleges. We're coming up, the state had 11 teaching colleges, medical colleges, till our regime had come in. Now we are actually opening up 16 medical colleges. So covering taking every parliament as a unit, so that there is uniformity in distribution. And a teaching hospital and a medical college together would provide for postgraduate students to come in and provide for the health care. So,
Thank you.
Let me add a perspective, I think, on primary health.
as she rightly pointed out, this is a major concern. In fact, to address this, the country as such had, under the leadership of the Honorable Prime Minister, had launched a program by name Ayushman Bharat. It's a more or less a combination of, it's more like an insurance part where the state governments are also involved in settling the claims. The funds come from central government, but it deals with 1,000 procedures or so. That is not sufficient, it's inadequate. So in the state of Andhra Pradesh, we have widened that scope, and we have come up with our own insurance scheme. It's called YSR Arogyashri scheme. I named it after my father because that's the kind of priority that I give to that scheme. So I just want it to be remembered, and I want to do a good job out of it. So what we have done is we've scaled the number of procedures to 2,446. From 1,000 what the central government supports, we had increased that to 2,446 procedures. And practically, we have distributed cards to 1.44 crore houses. And we've increased the limit for the eligibility of this card to income limit of 5 lakhs per annum. So anybody whose income is less than 5 lakhs per annum is eligible for this card. And 1.44 crores out of the total households of approximately 1.5 to 1.53 crores households that we have, 1.44 crore cards are covered under this scheme. Okay. And the last 3 years, we've helped almost 25 lakh people get treatment free of cost here.
We have to doing specific things, and economics of that have to come into the discussion about insurance, because curative insurance is not enough.